I'm here to talk to you today about Ergo-Flex's Cervi-Trac. Cervi-Trac is a cervical traction device that attaches to your back-on-track. Cervi-Trac is great to use when people have degenerative cervical disc disease, disc herniations in the cervical region. But one of the big things in the news today is called text neck, which is anterior head positioning from constant flexion from looking at all our devices. This device right here can help combat that with your patients and help to correct that postural disorder. So the way we're going to put the Cervi-Trac on our back-on-track is fairly simple. We're just going to take and rotate one of the arm pieces out of the way, and we got two hooks on the top that are going to hook on the tops of these arm pieces. And so it's going to slide on just like this. And once that's in place, everything is good to go in terms of getting patients on and ready to roll. This thing's adjustable from the bottom in terms of how it slides. It has two locking pins. They rotate and slide in, and that locks our slide in place. When we open those up, we now can adjust this to the proper patient height. And we'll show you how to do that with a patient here in just 1 second. One of the other things our Cervi-Trac has is an adjustable pillow system. It has 3 different heights, and we'll determine which one we're going to use based on the size of our patient. Now that we have a patient on the back-on-track, we're going to make the adjustments we need. Our patient here is a pretty small guy, so we're going to actually take the top 2 pillows off, and we'll just use a single pillow. Next, what we're going to do is we're just going to grab this sliding units and slide it according to what we need to as a patient lays back. So go ahead and lay back for me. And the way we want to position this is we want this pillow right about the mid-cervical region. And once we get that in place, we're just going to take and lock these pins back in to lock that in place so it doesn't move. The last thing we need to do is just take the harness that goes over the top of the forehead. What I like to do is slide that over the top of the forehead, and then what I will do is we're going to tighten that down from both sides. We don't want to just pull one side or the other because we'll tend to rotate the head. So just pull them evenly, just gentle, doesn't have to be overly tight, and just fasten those to the Velcro on the side. Now that we have the patient properly placed and fitted on the machine, we're going to now determine what protocol we're going to use. The 3 most common protocols we're going to use with our patients are A, B, and C. A is a static traction, it's just going to pull and hold. B is a gradient intermittent traction, which means it's going to pull to 1/3 the distance, then it's going to pull to another 1/3 of the distance, and then finally reach it at the end of the 3rd pull, the full pull. And then C is it's going to pull to our full length that we have, and then start to release. So we're going to just show you with A protocol today. So we're going to push our auxiliary button until we get to protocol A. Now that's on A, what we're going to do is we're going to set the extension portion of this. Now what you have to understand with Cervi-Trac is that we want a gentle stretch in the neck. We're not looking for a huge pull. So I like to start patients off around the 2 mark, which is 2 inches. And I'm going to start him off with this first one. I'm just going to set him for just a couple of minutes. We just want to see how he's going to do and tolerate the first time on this machine. So now that I have everything set, protocol A, 2 on the extension, and set for a couple of minutes, what we're going to do is we're going to hit the start button. As he lays back, I like to wait till the table rises up before I do the strap around his legs just to save my back. So once the table's up, we're just going to take and pull his legs nice and tight against the machine. Make sure that's tight, and he's just going to relax. As the machine pulls, I'm just going to talk to the patient to see what he's feeling. You feeling a pull? Just a slight pull?
Slight. Kind of rolling my head forward.
Okay, so what you want to do on this is you want to be careful that make sure our head strap is tight enough so it's holding his head down. And if it is too loose, it'll start to pull his head forward. So what we have to do on this is we're just going to tighten it down a little bit and make sure that's good and tight. And then as this pulls, what he's going to feel is just a gentle pull or stretch in that neck. The most common thing that we have is patients are going to typically say, I could take more of a stretch. I can take more. I can take more. That's very common. We see that with both this and the back on track. What you have to understand is we're not after more and more pull. We're just after a gentle stretch to slowly start opening up that cervical spine to allow those discs to rehydrate. And sometimes if you pull them too hard, there's going to be a lot of discomfort with the patient. We can start to get some numbness in the neck, and just a dull headache can result from just too much pull. So we're going to leave this patient in here for the duration of the 2 minutes. And as the patient's head comes back up and as he sits up, all we have to do to get him off this is we're going to release his head harness on both sides and slide that off his head and release the feet.